Good morning. My name is Ewauche, and today I'll be discussing hepatitis B diagnosis. Now, these are some of the things we shall be looking at. Look at them. Now, as the virus gets into the system in the form of hepatitis B surface antigen, the level can go sky high depending on the states of your immune system. If you have an active immune system, the body will produce an antibody to hepatitis B called immunoglobulin M to check the replication of the hepatitis B surface antigen. What you have noticed is that antibody to hepatitis B called immunoglobulin M is a neutralizing antibody, and it is designed to bind to the surface antigen in order to check the replication. Now, if it eventually succeeds in doing that, of course, the hepatitis B surface antigen will go down, and then the antibody to hepatitis B called immunoglobulin M2 will go down. There is always a window between the loss of the detection of the hepatitis B surface antigen and the beginning of the detection of the hepatitis B surface antibody. That period, that space is called the window period. Now, another important thing is the hepatitis B core antibody immunoglobulin G. It is equally called total antibody to hepatitis B core. Now, if its presence may signify either acute or chronic infection, not necessarily in chronic infection. During acute phase and during chronic phase, you may likely see the total antibody to hepatitis B core. Now, if the virus persists beyond 6 months in the system, I mean the surface antigen persists beyond 6 months in the system, it becomes chronic. So the graph by my right shows the chronic phase of the hepatitis B disease. As you can see, the hepatitis B surface antigen went sky high, and then the total antibody to hepatitis B core went equally sky high. There wasn't a decline in the threshold of the hepatitis B surface antigen, as you can see, but there is a palpable decline of the antibody to hepatitis B called immunoglobulin M. That shows that the body actually produced an antibody to check the replications of the virus, but the effort maybe wasn't enough to do that. So the virus progressed to the chronic phase. Now, here you can see that the surface antigen I explained, it is found, during an acute disease, and the persistence of the virus or the persistence of the surface antigen beyond 6 months is what we call the chronic states. The antibody is produced when there is no surface antigen, and the antibody is designed to protect us. Of course, we have the window period, end of the detection of the surface antigen, and the beginning of the detection of the surface antibody. The core antigen is found only in tissues, not in the bloodstream. So, and then we have the core antibody, which is the first antibody to appear. It can be IgM or IgG. If it is IgM, it signifies acute or recent infection, and if it is IgG, it signifies chronic infection. Remember, IgM, antibody to hepatitis B core, is a neutralizing antibody, and then the IgG, antibody to hepatitis B core, is not a neutralizing antibody. We have hepatitis B envelope antigen, which is a marker of replicability, the marker of high infectivity. So when the virus is actively replicating in the system, the hepatitis B envelope antigen will be positive. The hepatitis B envelope antibody is detectable after virus is no longer detectable in the bloodstream, and it suggests lower risk of infection. So you can look at this very well. Assuming your client presents with hepatitis B surface antigen positive, hepatitis B envelope antigen positive, and then antibody to hepatitis B surface negative, when it is in the IgG form, you know that the person is in the acute phase of the disease. So with this, you can see when someone, or you can know when someone is vaccinated, when someone has had an infection, they recover, when someone is in the window period, sitting between the window, you will know. And very high yield, and I want every laboratory scientist, every laboratory technician to tackle this on their body, the favorite part of their body, so that they will be able to know and interpret hepatitis B result if efficiently. So we have another test called the viral load. Of course, viral load measures the level of DNA in the blood, and the number of DNA correlates with the level of circulating viral particles. The unit can be given in IU per mils or copies per mils, and if it is given in copies per mil, you can convert to IU per mil by dividing by a factor of 5. So assuming you have 10,000 IU per mil or 10,000 copies per mil and you want to convert it to IU per mil, is to divide 10,000 by 5 and you get 2,000. APRI is another test that is very high yield and gaining ground in the laboratory. We call it aspartate aminotransferase platelet ratio count index. The formula is given thus. Let's look at it. So APR is given as AST all over upper limit of normal multiplied by 100 all over the platelet count. So assuming your AST is 25 and your upper limit of normal is 40, and then multiplied by 100, your platelet maybe is 109. So you are going to get 0.625. Am I sure? Yes. Multiply it by 0.917. I think so. So you're going to get 0.57. So APRI less than or equal to 0.5 shows that there is no scarring or fibrosis in the liver, or maybe a very mild one. And APRI greater than or equal to 1.5 shows that there is a scarring in the liver and you need to raise an eyebrow. So these are some of the relevant laboratory values. As the virus gets into the system, the immune system will not sit idly to react. In the process of reacting, enzymes, cells will die and enzymes will be leaked out of the cell. Some of the enzymes are the ALT, AST, alkaline phosphatase, a whole lot of them. So they appear in a certain range in the system. So if the values go beyond or below those ranges, it becomes a problem. So these are some of the ranges you should be familiar with as a laboratory scientist or a laboratory technician. Again, I have talked to you about viral load. I've talked to you about hepatitis B profiling, the fibrosis. Another important thing is the prothrombin time test, because in addition to LFT and CBC, it is pertinent to do the prothrombin time test. In fact, even more important, the LFT and CBC in detecting liver fibrosis. So depending on the value of the prothrombin time test, you'll be able to decipher whether the liver is in a healthy state or not. So in addition to LFT and CBC or full blood count, please include prothrombin time test to give you a broader perspective of how healthy the liver is. Thank you very, very much, and do subscribe to my channel, right?